On this week's edition of Today's Health, we visit a hospital in Texas that is helping low-income families get access to fresh produce that they cannot afford. Haley Hernandez reports.
They get a fruit and vegetable prescription.
Nurse practitioner Lisa Kimmy Walker says many of the young kids she cares for have high cholesterol, blood pressure, and are pre-diabetic. But they're counting on these coupons to break the cycle.
How many fruits and vegetables you eat? Now, many of them were at 0 when we started. And now they're eating 5, which is, the national target, which very few children are able to achieve.
Joseph says he's hitting that mark. At 11 years old, he's just discovering he loves broccoli and tangerines and is quickly losing weight.
Praise God, he lost 5 pounds. He lost 5 pounds in a week. I'm proud and I'm very happy. I'm just full of joy.
The only requirement to stay in the Wholesome Wave program, the families have to attend 3 classes to learn to read nutrition labels and to better incorporate vegetables into their daily meals. In this class by the Houston Food Bank, Evelyn's learning to cook squash, tomatoes, and onions, something she couldn't even afford to try before.
Every time I would buy it, it would take like most of my food stamp because it's so expensive.
These coupons that can be used at Target or farmers markets are used in addition to SNAP. And medical experts know having free options isn't the best part of the program.
They are healthier on their lab work. They're healthier with their measurements. The children are reporting back that they're doing better in PE in school.
I'm going to put 5. I know 5.
The program has shown success in other cities such as Los Angeles and Miami as well. Families' health improved and businesses saw more new customers buying products in their stores. In other medical news this morning, new data reveals who is most at risk of dying from an opioid overdose. Researchers at Columbia University Medical Center studied 13,000 overdose deaths. Over 60% of people who died from an opioid overdose have been diagnosed with chronic pain, and many suffered from a mental health disorder. About 1/3 have been diagnosed with a drug use disorder in the past year, but most had dropped out of treatment within a month prior to their death. And as the debate about mammogram frequency continues, most women say they want to be screened every year. Some medical groups recommend biannual mammograms for older women to prevent anxiety from false positives and unnecessary biopsies. However, a new survey shows 71% of women prefer to be screened once a year despite these risks. And finally, having strong social relationships could help people survive cancer. Researchers from Brigham and Women's Hospital in Boston followed nearly 900 women diagnosed with colorectal cancer. Women who had close ties with family and friends were much less likely to die from cancer or any other cause than those with fewer social networks. Experts believe having support from social networks may help lower inflammation in the body and reduce psychological stress among cancer patients.